Welcome to our special program on China's new phase in the fight against COVID-19 that's called Moving Forward. I'm Li Xin, coming to you from Beijing. Starting from January the 8th, China officially downgrades its classification and management of COVID-19 from Class A back to Class B. This is a major shift in China's COVID response strategy. What drove China to adopt the new measures? What has the last 3-year period meant as we go through the adjustment? How are the Chinese government and people coping with the surge in infection, and how to address some of the concerns expressed by the outside world? I'm extremely pleased to be joined from Beijing by Dr. Xiao Yiming, former chief expert on AIDS at the Chinese Center for Disease Control and Prevention, and a current member of the Vaccine Task Force of the Central Government COVID Control Mechanism. From Washington, D.C., by Dr. Kate Tolenko, CEO of the health workforce company Corvus Health and former vice president of the IntraHealth International Health Systems Innovation, and from Singapore by Professor Wang Ling Fa, emerging infectious diseases at the Duke National University of Singapore Medical School. Dr. Xiao, let me go straight to you. This is a very significant day. The measure was announced on December the 26th, but today is the first day officially that the new measure will go into place. So what exactly does it mean to downgrade China's COVID strategy from China COVID response from Class A to Class B?
I should make it clear that originally the COVID-19 is also Class B, but for certain Class B infectious disease, we upgraded it to Class A management, control management to Class A. Like a dozen years ago, the SARS, the SARS-CoV coronavirus 1, what we call SARS, has been also Class B, but upgrade into Class A management. Now, since the control has worked for 3 years, and there's new situations, like the virus has evolved into a less virulent form, causing less severe case and less deaths. A second change is that we have the vaccine, and starting from the beginning of the second year, we have already in China more than 3.4 billion doses of vaccine has been vaccinated. So we have a building a kind of a certain level of herd immunity. And also the third change is globally, almost all countries have been lose their control management. So with the 3 new environment, I think it's a time to downgrade back to Class B.
So what exactly does it mean to downgrade it to Class B? Does it mean that China is just going to let it rip, or is it still a kind of a new response, but with different strategies to fight and to try to bend the curve of infection?
Yeah, I think it's the second case. Since the major infectious disease we are dealing with, most of them are Class B disease. Class A, we have only 2, plague and cholera. They are very small numbers.
Cholera,
yeah,
you mean?
Yeah, Class A. So major infectious disease are all, we are focusing on Class B. Class B is, most of the Class B diseases, they stay more or less permanently. So we have to have a new normal. We cannot, due to one infectious disease, we put down all the normal life. So, but in emergency, like SARS, at the beginning of the SARS in 2003, and also sometimes even high passage avian flu, in the emerging time, we upgrade the Class B disease into Class A. And then when we into a constant mood, we are back to Class B.
But specifically in specific terms, let me go to Professor Wang for your understanding in terms of Class B. Is it just let it rip, do whatever you want, or is China still trying? From what you're reading, what you're hearing, are there still measures taken by the Chinese government, according to my understanding, of course, but to help the international audience understand what is China's management of Class B?
Well, I think in my view is that to let it rip, I think definitely is not the way to go, right? So I think it has to be a stage-wise. And my understanding is that, for example, public places, you still need to keep a mask on. So it's still being managed, but it's a huge jump, I think the biggest difference is home quarantine. So that really was kind of established to provide convenience. And obviously, it's not going to be as strict as a specialized quarantine facility. So the transmission, as we already realized, is going to be much more faster. But I think Class B means that really kind of downgraded the quarantine and the management. And now is the time, I think, just like in other nations, I have experience in Singapore and Australia, is that the citizens now need to really take more active role because the government have done 3 years. And so Class B means that, the centralized quarantine management is going to be less important. And now it's the society and the community need to come in, do their best, and still try to at least slow down. I don't think you can prevent the transmission anymore, but what we call is flatten the curve. So you don't want a sudden surge. And then
one of the most important features of this Class B or return to the Class B management is that international travels will be much more facilitated. For instance, there will not be mandatory quarantine for arrivals, and that there will not be close contacts that are counted. There will not be classification of high risk areas versus low risk areas. In terms of international travel, especially from this day on, what would that mean, Professor Wang?
Yeah, so I mean, that's a big decision, right? As far as people both inside China, outside China, one of the inconvenience complaints about zero COVID policy is that the international border basically is shut, right? So this to me is a very significant change in terms of go to Class A to Class B. And also that not only you're allowed to travel, and as long as you have a negative PCR, you can go in, but if you get a positive, you do home quarantine. So to me, that's one of the biggest, for people like me living outside China, I mean, within China, of course, you have other impact, but for people outside China, to me, that's the biggest change.
Mm-hmm. Dr. Tulenko, pretty much every country went through this process, right, to go from strict control or lockdowns in the early phase of the pandemic to now in a more managed but more scientifically based approach, because the virus is just too pathogenic, or the spread is too fast for any human effort to be able to contain it. Now that China has also finally taken these steps, but what difference does it make in case of China compared to other countries, especially major countries with big populations? Basically, China took much longer, a couple of years, some would say, until China finally adopts this step. What difference would it make for a country such as China?
I think the main difference between China and most other countries in the world are the very large elderly population that you have. And that as a result of that, we're going to see, I think, higher rates of mortality amongst the elders in China. And another big difference is the difference in access to healthcare between rural and urban areas. In most countries in the world, there is, of course, better access to healthcare in urban areas, but in China, that's more markedly pronounced than in Europe and North America. So you're going to see much higher mortality rates in rural China than in metropolitan urban China.
Well, let's make it absolutely clear, because you're talking about higher rate of mortality because of China's relative large proportion of elderly population. China has become a rapidly aging population. 20% of the population, for instance, is aged over 60 or 65, around that rate. But does that necessarily mean that the mortality rate will be higher Dr. Tulenko?
Yes, it does, because we've seen in every country in the world that seniors are much more likely to have serious complications and to die from COVID than younger people. So, and when you spread that over a population, you will have a much higher mortality rate than if you had a younger population. So there's no doubt about that. But we need to put that in the context that China having an elderly population is a success story, that people have that longevity. So it's just one of those negative linings of a success story.
Dr. Shao, what is your take of the situation? Because China did, as I said, open up much later. We've had 5 major strains or variants of COVID-19, being Delta, Alpha, which were much more lethal in a layman's term. Right now with Omicron, although the pathogenicity, it spreads much faster, but does it necessarily mean that the mortality rate will be higher compared to other countries?
I think the aging population, because we know the younger children, they have a very less severe cases. Older people, they have preconditions, pre-disease, so they are easy to get severe cases. That's true. But that can be through the active prevention work, like vaccination, can reduce the death cases to over 100-fold down, and severe cases about 20 to 40-fold down. So through active intervention using vaccines, we can reduce that risk. And also, China's aging population actually relatively many developed countries have the similar aging population, or even more aging, like Japan or some Western European countries. So that is only one factor. And as our American colleagues mentioned, that longevity is a good thing, is a progress of social development. I have noticed that in United States, in the compare last year to 2021 to 2019, in the first 2 years of COVID, their expected life expectancy have reduced 2.7 years. But in the same time, Chinese life expectancy increased 0.9 years. And actually now we are at the life expectancy of 78.2 years. US reduced to 76.4 years. So we are 1.8 years longer than US, a developed country. So that is a great achievement. And that means in the first 3 years, we did a very good job. In addition to vaccine, we could also prepare our health infrastructure, especially in rural area. And I noticed yesterday the Health Commission of China have a special press briefing for prepare the rural areas to strengthening all the from testing to hospital to medication, while at the same time to increase further the vaccination coverage of the older population.
Dr. Tulenko, if you want to respond, of course, you're welcome. But I would just go to Professor Wang here for your take as well, because there is a time gap of at least 2 years to around 2 years that China finally took the steps that the other economy, other regions have taken in terms of how to react to this virus. What does this 2 years mean, and what kind of challenges China faced with at this moment?
Yeah, I try to put it in a philosophical way. Every policy, every action has both the down and upside, right? So the 2 years delay, if you like, of so-called living with the virus that the Chinese government has adopted certainly saved lives. And as Professor Shao says, the average life expectancy actually increased during the last 3 years. But the downside is clearly that, that you accumulate a population almost naive. You have the vaccination, but in terms of exposure to real live virus infection, then China is kind of zero, right? So the zero COVID was successful. So the downside is that means that the population is very naive. We only have vaccination. And that's why when the virus comes in, so especially with the Omicron, it's very, very transmissible. So that's what China is facing right now. Basically from zero COVID to 50, 70, 80% of population got infected. It took 3 weeks. For a country like Singapore and Australia, it takes, 2 to 3 years, right? So that is a challenge right now to me that, so the upside is you save lives, and the last few years, China was relatively safe and healthy, but now suddenly, you go to that high rate of infection. So the two professors already, doctors discussed about this mortality or fatality. So I tried to really just add on to say, in this day and age, it's very hard to define the exact case fatality to compare between countries because the strain is changing all the time, right? So the case fatality, during Delta days is higher, right now is lower. So I think, if we're going to compare the aging population in China, we have to also take into consideration that the strain is different. The strain we're facing now is much more transmissible. So with China, it's a numbers game, right? Even if it's a low percentage, but the absolute number will be high. Thank you.
Dr. Talengo, you want to react?
I agree with what both of my colleagues are saying. This is a very complex situation, and it's really difficult in unprecedented cases like this to say what's the right path. I mean, we can make the most evidence-based plans and then see how it plays out. I think one thing that is very different from China's approach versus other countries' approach is most of North America and Europe chose to vaccinate the most vulnerable, so the elderly and people with chronic diseases, whereas China, in order to keep the economy open, chose to vaccinate workers. And so as a result, not as many seniors have been vaccinated as would have. And so that's another thing that's leaving them vulnerable. And I know that the government is really pushing now to vaccinate seniors, and that's good, but they really need to step up on that to protect as many seniors as possible.
Dr. Xiao, any reaction on what was just said about, for instance, the sheer number, the absolute number versus the percentage, even though the pathogenicity is lower, what is China's consideration in terms of that? And also the difficulty in terms of getting reliable data at this moment, because China stopped massive testing of nucleic acid test. So how can we gauge exactly what has been the percentage of infection and the number of severe cases and so on and so forth?
Yeah, I think as for testing, in the class B disease, we mainly do surveillance through the professional institutions like CDC. They have do surveillance. Formerly in the class A, we rely on screening, almost test everybody. So we have done to the professional institution surveillance work for infectious disease. So in that case, this to know the number, the professional institution have to play a major role there. To back to the class B disease management new normal. As for, I totally agree, because we have this zero COVID policy. In the first 3 years, we kept the infection at bay. So save a lot.
Right now, to follow up on the data collection, right now, how is data collected? Is it only done through random sampling, or is there some kind of official tally going on to know as good as possible?
For surveillance, we have the sentinel sites. They are mostly located in the different level of hospitals, and also in some sentinel site, which is we do active sampling. Combine these two, we have this nationwide infectious disease reporting system. That reporting system, they regularly release the results. So that's for many infectious diseases like AIDS, hepatitis, measles, everything they do rely on that data. So that's part. I think I totally agree with Lin Fang. Everything have a double edge, two sides. We have kept the first 3 years at a very low infection rates, and but we have no herd immunity due to natural infection. We know the vaccine is like a tiny immunogen into the body. Infection is a lot of virus in the body, so they are usually stronger than the immunization. So in the developed country and some other developing countries, they have the hybrid immunity induced by both vaccination and natural infection. So we have only one. Now, I think we have to catch up with this new wave of infection. So we are building the hybrid immunity. And also, there's another thing. China actually, vaccine development is very good. We have approved 13 vaccines, all 5 technical platform vaccine we have. We have 5 inactivated vaccines. We have 5 protein vaccines. We also have 2 kinds of viral vector vaccines. And also we have just recently approved 2 nasal use vaccine, which is a mucosal vaccine. This is what the WHO encouraging further development for nasal spray vaccines to not only to reduce the severe cases and deaths, but also play some role for prevention of infection.
Yeah, well, so basically China won some time, by putting in place a very restrict regime against the virus to prevent it, into developing the vaccines, the treatment packages and so on and so forth. But right now, as Professor Lin Fang said, there is a huge wave. There had been actually a wave, some people call it a tsunami of infection. And now what we're seeing in the major hospitals are the severe and critical cases, especially with people with underlying conditions. What is China doing, or what are Chinese hospitals doing right now, in addition to what they did over the past 3 years, to fight this wave of severe critical cases? Professor Shao, Dr. Shao.
I think formally in the first 3 years, the main focus is on prevention of infection spread. Now is prevention of severe cases and protect of our health infrastructure resources, and reduce to the maximum possible way the death cases. So we shift from prevention of infection to disease, severe cases and deaths. So that's the goal difference between the change.
What are being done? Because I'm reading a lot of numbers. For instance, right now, China is pushing for all the rural villages and townships, counties to set up a fever clinic. The number is almost 98.8%, meaning almost all county level clinics have a fever clinic. And, there are 57,000 altogether fever clinics at this moment, and they're also doing a complete investigation of people above age 65. Right now, almost 200 million has been done. That is more than the population of the United States, for instance, to classify them into different level of vulnerability and using a color system, red, yellow, or green. How much work is being done over there to make sure that they can handle the wave of severe critical cases as infections spread out into the rural area to smaller cities from major cities such as Shanghai, Beijing, and Guangzhou?
Yeah, I think they just released a new COVID prevention and treatment guideline, the version 10. They prepared rural area hospital, as you mentioned, fever clinics, they account for 60% of the country's total. And also yesterday they had to hold the press briefing for the rural preparedness for this wave. I think all the work you mentioned are valuable. And also they are shifting, increase the production of medications, and including domestic ones and imported ones. The newly US developed antivirus, they are all available now to provide the care. And also oxygen and oxygen situation measure, equipment, everything has been on site now.
Yeah, Dr. Tulenko, from what you're reading on the media there, what are the major concerns there? And do you think they're being adequately addressed, or the right kind of measure are being taken adequately to prepare to handle the wave of critical cases, especially the capacity in the ICUs?
Yeah, so I wanted to first say that I think these fever clinics are so important. We saw them be highly successful in Europe and North America. They were positioned mainly as respiratory clinics because you have to prevent the hospitals and the emergency departments from being overwhelmed. So if you can evaluate people in the community, determine who's high risk, who can just take oxygen at home, has people at home to take care of them, versus who's high risk and has to be in the hospital, and also realize that during this time, people are going to have heart attacks, strokes, people need cancer care. So you need your hospitals open for all that other type of care. So having these fever clinics in every community is going to be a really important part of the response. As far as, sort of wanting to know more, I would want to know more about, what is the status of the hospitals as far as staffing and equipment and pharmaceuticals now versus how it was 2 years ago. Because in all countries in the world, we have an acute on chronic staffing shortage. And, we have doctors and nurses who are just exhausted after, 3 years of these extra high cases with COVID and increased attack on health workers everywhere. So that's what my main concern is, and making sure that they have that resilience built into the hospital so they can tackle the extra load that, despite all efforts, is going to come.
Going forward, how much optimism do you have looking at the different customs, different culture of the Chinese society? Because everywhere I go, for instance, everybody is still wearing masks. So how optimistic or how pessimist are you about the next weeks to come?
Yeah, I'm very optimistic. I think, China is at an advantage, as is all of Asia, that you already have a culture of mask wearing, whereas we did not have that in North America and Europe. And also you can, compare the more communal cultures with the more individualistic cultures. In the communal cultures, you understand the purpose of protecting others, that you wear a mask not just to protect yourself, but to protect your neighbor and to protect your loved ones.
Many thanks to Dr. Xiao Yiming, Dr. Kate Tulenko, and Professor Wang Lingfa. That's the first half of the special program called Moving Forward on China's COVID strategy. On behalf of the whole team, thank you for watching. You've got the point.